If the patient is on a higher supraphysiological dose of glucocorticoid or has unsuppressed adrenal androgens, then Crenessity clearly has a role. So before the advent of Crenessity, I feel like I'm treating a disease with two aspects, but with only one tool. Kind of like you drive a car that can only turn right, so you can turn right 3 times to turn left. So now with Crenessity, I basically have a car that can turn both ways, and I can specifically target my patient's specific needs. For one patient, I have been able to reduce the glucocorticoid dose while maintaining his adrenal androgen levels. When I tell my patients about starting Crenessity, I let them know that the most common side effects adult patients experienced in the clinical trial were fatigue, headache, dizziness, arthralgia, also called joint pain, back pain, decreased appetite, and myalgia, also called muscle pain.
I have been able to decrease glucocorticoid after starting Crenessity on a child who's now 8 years of age, who was over the last 1 year has been gaining weight, because I think around the 7 or 8 years, the adrenal androgens ramp up. So I was increasing his glucocorticoid dose. But there is also another 15-year-old, and we're having to do a little bit longer Crenessity dosing before we can lower the hydrocortisone dose. But overall, her androgen levels are also coming down. That's a good news. Androgen levels are coming down. I'm just giving a little bit more time on just Crenessity and the same hydrocortisone dose before we step down. When I tell my patients about starting Crenessity, I let them know that the most common side effects pediatric patient experienced in the clinical trial were headache, abdominal pain, stomach pain, fatigue, nasal congestion, and epistaxis or nosebleeds.
With Crenessity, and one of my patients, a young girl, she's in her 20s, but she came back, and it was interesting because she said, I just don't feel as hungry anymore.
Yeah, the 15-year-old that I just talked about, she also reported exactly the same thing. She's feeling less hungry, she lost weight, and that's directly because of the androgen levels coming down.
Yeah.
Was it before you adjusted the GC dose?
This is before the adjustment of the GC dose,
Yeah. For my patient, he also lost weight, and he also now takes less frequently the hydrocortisone. And now he kind of asks us that why I took a higher dose before, and I say, well, that's because we did not have Crenessity at that time.
Indication. Crenessity, crinecerfont, is indicated as adjunctive treatment to glucocorticoid replacement to control androgens in adults and pediatric patients 4 years of age and older with classic congenital adrenal hyperplasia, CAH. Important safety information. Contraindications. Crenessity is contraindicated in patients with hypersensitivity to crinecerfont or any excipients of Crenessity. Warnings and precautions. Hypersensitivity reactions. A hypersensitivity reaction, including throat tightness, angioedema, and generalized rash, occurred in a subject after 3 days of treatment with Crenessity. If a clinically significant hypersensitivity reaction occurs, initiate appropriate therapy and discontinue Crenessity. Risk of acute adrenal insufficiency or adrenal crisis with inadequate concomitant glucocorticoid therapy. Acute adrenal insufficiency or adrenal crisis, which is potentially life-threatening, can occur in patients with underlying adrenal insufficiency who are on inadequate daily glucocorticoid doses, especially in situations associated with increased cortisol need, such as acute intercurrent illness, serious trauma, or surgical procedures. Continue glucocorticoids upon initiation of and during treatment with Crenessity. Do not reduce the glucocorticoid dose below the dose required for cortisol replacement. Patients should continue to use stress dosing of glucocorticoids in cases of increased cortisol need. Adverse reactions. In adult patients, the most common adverse reactions, at least 4% for Crenessity and greater than placebo, are fatigue, headache, dizziness, arthralgia, back pain, decreased appetite, and myalgia. In pediatric patients, the most common adverse reactions, at least 4% for Crenessity and greater than placebo, are headache, abdominal pain, fatigue, nasal congestion, and epistaxis. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit MedWatch at www.fda.gov/medwatch or call 1-800-FDA-1088. Dosage forms and strengths. Crenessity is available in 50 mg and 100 mg capsules and as an oral solution of 50 mg per milliliter. Please see full prescribing information.